that plastic surgery is majorly about reconstruction and creating awareness about plastic surgery itself. Reconstructive surgeon, we come across many cases which
a severe burn on their face. Dr. Nilesh, welcome to the Scalpel's Edge, our podcast on medical device innovation and social impact. So, um, just to tell the audience about the first time that I came across you was back in 2015, I think.
2018.
2018, yes, 2018, when you had hosted the Indian Society for Reconstructive Microsurgery conference here at Mumbai, and at that time I had just I was very fresh out of the college, ready with a surgical device innovation, and I was trying to find an audience for that. And you were among the first surgeons who gave that innovation a stand, and also a stage to present it to the surgeons around India, and also there were international delegates there. So I guess a lot of credit for beginning my career goes to you. So that way, this podcast is very special for me. And would you like to tell more about the work that you do about reconstructive surgeries, and how a common person can relate to it?
So first of all, thanks a lot, Anand, for having me on this podcast, and I'm sure that this is going to make an impact and help us achieve the goal that we are looking at. Yeah, at the outset, just about the memories from ISRM 2018. So what really made us go forward or to support your innovation at that point of time was your sincerity and the effort that went behind the product, and the real innovation that it was. So it was really a great idea, because that was the basic problem which any microsurgeon would face in his day-to-day practice, and the innovation was really perfectly planned to deal with that problem. So definitely, it was our pleasure to have you as a part
Thank
of
you.
that conference. And coming back to like my current practice, see, I'm into hand surgery, I'm into reconstructive microsurgery, and I'm into reconstructive surgery of all kinds. So we deal with complex defects, we deal with complex problems, and we try to innovate at each step in order to customize our solution to the requirement of the patient. So
Excellent.
plastic surgery is all about problem solving. It is all about giving the patient what he deserves, what he wants.
Okay.
So the problem is never the same for any two patients, and the solution also is never the same for any two patients.
Right.
So you have to keep thinking and innovating each time,
Hmm.
and to for that, microsurgery is our biggest aid,
Right.
because microsurgery has enabled us to do things which were unimaginable few decades back.
Yes.
Today we are able to deal with much more complex problems, much more complex defects
Right.
in a much efficient manner, and that is all thanks to microsurgery.
Yes. Absolutely. So, from my understanding of the exposure of microsurgery, reconstructive surgery, and plastic surgery, what I understand is that the common impression of plastic surgery is more related to the aesthetic or the cosmetic side of it. But there is also an arm of plastic surgery, which is the reconstructive surgery, which essentially deals with repairing the function and the appearance of various body parts. Sometimes it can, apart from the aesthetic applications, it can also be applied to patients who have trauma injuries, for example, finger cuts or hand cuts, amputations. It could also be applied to um, cancer surgery patients who have had their tumor removed and need to re-establish the form and the function of their body. And there are birth defects as well. So could you tell us a bit about some of the cases that you have dealt with where an individual presented their special case to you and you were able to help them through the medium of surgery, and what was their life before and after that surgery like, if you remember any exceptional cases that have come your way?
So as you rightly mentioned, that plastic surgery is majorly about reconstruction. In fact, more than say 70-80% of plastic surgery is about reconstruction of some kind. Whether it could be birth defects, it could be a cleft or craniofacial surgery, or it could be congenital hand surgery, it could be hand surgery proper, it could be onco reconstruction or reconstruction related to different cancers, either head and neck cancers, breast cancers, or soft tissue or limb tumors. Plus, burns forms a major part of plastic surgery. So, plastic surgery encompasses a very wide spectrum of disorders.
Right.
And of course, cosmetic surgery is an integral part of plastic surgery,
Hmm.
but because of its glamour quotient, it gets highlighted more often.
Right. Right.
Or that is what the people commonly associate plastic surgery with it.
Yes.
And to share the blame to some extent is the misleading name of the specialty.
Okay.
Because plastic surgery per se does not indicate any particular organ system.
Yes.
So it is very difficult for the lay person or a common man to exactly correlate plastic surgery with some body system.
Yes, yes, it's a little different from how the other specialties of surgery are named. For example, there is cardiovascular surgery, which is related to the heart. Then there is a neurosurgery, mostly related to the brain and the spine.
Exactly.
But plastic surgery is more of a branch which spreads across different specialties of surgery. If I'm
Yes.
right. Okay.
So yes, but that's a thing that we always accepted as a part of it, and creating awareness about plastic surgery itself
Right.
has been our way to go about. And as a hand surgeon or as a reconstructive surgeon, we come across many cases which make tremendous difference to somebody's life.
Yes.
Because hands are our basic tools with which we work, with which we earn, with which we express our emotions, with which we interact with our surroundings.
Yes.
And the society.
Yes.
So hands are extremely important, and any hand injury, whether it is a minor injury or it is a major injury, that the gratification or the satisfaction of restoring a hand back to normalcy is beyond words.
Yes.
So whether it is a replantation surgery in which a part of the hand, either a thumb or a finger or the hand, completely gets detached from the body,
Right.
and then it is an emergency surgery where it has to be reattached, all the structural continuity has to be restored.
Yes.
And then it is followed by a rehabilitation process in order to make the hand functional again. But the amount of satisfaction that it brings for the patient to have his body
Yes.
part restored again, and for the surgeon to be able to do that is tremendous.
Yes.
So that is one of the most gratifying hand surgeries I would recall.
Yes.
In addition to that, there are many complex situations in which a hand could get paralyzed following a brachial plexus injury. The nerves which are supplying the hand would get damaged for
somewhere
some reason.
Around the shoulder area. Right?
Yes, yes. So it could happen at the time of the birth also. Sometimes difficult birth and labor can cause abnormal traction on the brachial plexus,
Right.
leading to a paralyzed limb in a newborn
Right.
child.
Right.
Or sometimes due to fall from an height or due to vehicular accidents,
Yes.
the brachial plexus can get injured, and it will leave the person with a paralyzed or a flail limb.
Right.
And restoring function to that limb also is a challenge that we always take upon, and that also gives you quite a very high amount of satisfaction in order
Yes.
to restore these patients back to life. And one of the most important things that we or I and my team has been able to contribute in the recent past is transplantation surgery.
Right.
So for individuals who have lost their hands or who have lost their upper limbs at different levels, which could not be saved for some reason,
Hmm.
and who are living a dependent, compromised, suboptimal life,
Right.
transplant has been the biggest boon.
Right.
So a transplant technically means that a brain dead donor would donate their organs, and that organs we can transfer to somebody who has lost their limbs.
Yes.
So of course it is a complex process. It is a complex procedure which is accompanied by an equally complex medical management
Yes.
that goes along with it.
Right.
But the amount of effort that it demands totally is justified because of the outcomes.
Hmm. Hmm.
The way it changes somebody's life entirely, the way it restores their functionality, it restores their body image, it restores their self respect, it restores their dignity.
Yes.
It is incomparable to all the difficulties that you have to go through
Yes.
while performing these procedures.
Indeed.
So hand transplants have been an extremely gratifying experience, and we are happy that we could contribute to the society and to the country
Yes.
to some extent by delivering these outcomes and restoring the lives of these individuals
Yes.
who were denied a chance to live a fruitful life.
True. In fact, I had been following some of the stories of your surgeries in news articles and podcasts, where one of the patients who had lost both their limbs, where they underwent a microsurgery hand transplant, and after that they were able to drive a two-wheeler, fly kites, and basically have a radical shift in the way they were living, and also become more acceptable within the society. And I've also come across some stories where burns patients, typically who have um, a severe burn on their face, and some of them say maybe who are much younger in their life, and who are probably um, yet to get married in societies like India, where that becomes a very, very important part of life. And because of the deformity that is caused on the face, they would not be able to find a suitable partner, or they may have other social stigma attached to it. And that is also where reconstruction and plastic surgery helps the patients in a great way. And access to having such surgeries is definitely very, very critical. So in one of the podcasts, you had mentioned earlier that in India there are about 25,000 hands that get cut every year, and I'm sure along that is just a number for hands. There would also be leg injuries. There would be injuries to fingers and smaller body parts, basically. So, what do you think would be the extent of the actual need for reconstructive surgery around India, and how much of it is it that we are actually able to cater to? Is there a gap between the two?
Yes, there is definitely a very significant gap in between the needs and the services that we are able to provide. So yeah, these statistics are still rough. I mean, they're not fixed because we don't have a hand registry in India.
I see.
So all the hand injuries, ideally, we should have a hand registry for the country, in which all the hand injuries should get reported.
Right.
So that will
Right.
give us the true statistics of what is happening in terms of minor injuries, in terms of major injuries, and it will also help us to follow the trends.
Correct.
Of course, the mechanization of industry or the safety with which the industry operates these days has made a significant difference in the types of injuries that we are seeing. The types of ghastly crush injuries or amputations that were common 2 decades back has gone down very significantly.
Right.
So the trends keep changing with time. The spectrum of injuries keep changing with time.
Yes.
And we are not in a position to give the exact statistics because there is no way we can measure it.
Correct.
In the current scenario.
Correct.
But the Indian Society of Surgery of Hand for the Hand has been trying to create a hand registry at a national level, so that all birth deformities, all hand injuries get reported, and we get a national statistics available to provide services accordingly. Coming back to the gap of the between the services and the need. Of course, in the remote villages in India, or in the remote towns, the microsurgical expertise is still lacking. Of course, with time, the number of plastic surgeons or the number of microsurgeons who are performing microsurgeries is definitely increasing.
Yes.
But considering the size of our country and our population base, we still are very far and few.
Yes.
So there is definitely a significant gap in the demand and the supply, and that is the reason why the treatment or the standard of care gets compromised at different levels.
Yes.
You cannot provide the same standard of treatment in a tier A city as compared to what it could be in a type 2 or a type 3 city.
Yes. Yes.
So the infrastructures are not uniform. The expertise is not uniform.
Yes.
And more importantly, we are short in numbers.
Yes.
To be able to deliver the same quality of care and the same outcomes at a peripheral level.
Right.
So we as a country still have a long way to go in order to improve the healthcare facilities, and improve the healthcare services to be delivered at the grassroots level.
Yes. Yes. That's a very valid point, because the infrastructure in metro cities and then tier 2 and tier 3 cities is very vastly different, and it has also been studied by several agencies, and even Lancet had a very informative article about the access to surgeries in India, and how there have also been many other studies which have shown time and again that we are always in always in a great shortage of trained medical personnel, trained surgeons, anesthetists, and many more. According to you, what could be the most impactful change that we can bring to the microsurgery and the reconstructive surgery space as of today? If I can elaborate a bit more on the question, if there was one problem that you can choose out of all the problems that are out there in the space of reconstructive surgery, what would be that problem that you could dedicate your life to?
That's quite a tough question. Uh, but yeah, the problem that comes to my mind instantly, because I've been involved in hand transplantation surgeries, is something which is actually non-surgical. But yes, that is one of the major problems in any transplant surgery, and that is related to immunosuppression.
Okay. Okay.
So
Yeah.
immunosuppression is what makes a transplant complex.
Right.
So we are actually looking at some medical innovation or some breakthrough which will make immunosuppression safe,
Yes.
or which will simplify the immunosuppression.
In the words of a common person, what does immunosuppression mean, and why is it important in hand transplants?
So because see, every individual in this world is different from each other.
Yes.
we are structurally different, we are genetically different, we are at a molecular level, we are different from each other. So the body is programmed to identify what is self and what is non-self.
Right.
So in a transplant, when somebody else's body part is attached to the recipient's body,
Right.
his body is always going to remember that this part is not mine,
No, okay.
and then it is going to feel a sort of threat from that organ, and it will naturally, to protect itself, it is going to attack that organ, or it is
Okay.
going to reject it.
Right. Like a foreign material.
Yes.
Okay.
So to prevent that, the certain medications are given to the recipient, which are called as immunosuppressive medications.
Okay. Okay.
And these medications, by default, their purpose is to suppress the immunity of the recipient, so that his immunity cannot reject the transplanted organ.
Right. It will. Um, it wouldn't accept it, but it would at least stop fighting.
Yes,
with it.
there will be a symbiotic relation between
Yes.
the recipient's body and the transplanted
Yes.
organ, so that the organ continues to function.
Yes.
If the recipient's immunity gets active, then it is definitely going to reject the organ.
Correct. Correct.
So continuing these medications on a daily basis throughout the lifetime is essential for any transplant.
Absolutely.
So that is what makes the situation challenging. Suppose you are subjecting your body to medications on a daily basis throughout your lifetime, you are bound to have some face some side effects or some complications related to those medications.
Yes.
And that is what makes the overall transplant scenario a bit challenging or a bit difficult, because you are ultimately subjecting your body to lifelong medications.
Yes.
So if there was a means to simplify this process,
Yes.
if there was a means to increase the safety of these medications,
Yes.
if there was a means to avoid these medications to a certain extent,
Right.
that could revolutionize the transplant scenario. If what that could mean is that you could transfer tissue from one person to other without the person actually having the risk of facing the side effects or complications related to the medications.
Yes. Yes.
That could also mean that whatever uh, free flap reconstructions or soft tissue reconstructions that we are doing currently
Yes.
could happen through cadaveric donations.
That would be revolutionary. Yes.
So then you, without having any scar on your own body, or without sacrificing any other part of your own body,
Yes.
you could get these tissues from a cadaveric source.
Correct. Correct.
So that could really change the dynamics altogether.
Absolutely.
And just as you mentioned about acid attack victims some time back, acid attacks are devastating. They cause irreversible and irreparable damage, to such an extent that whatever effort in reconstructive surgery or in microvascular surgery we can put in, we still cannot restore the natural look of a face.
Yes.
Whatever is reconstructed is still a compromise.
Yes.
And in that situations, what could really help these patients is a face transplant.
Yes.
So again, because these transplants are not life saving, we need to be extremely cautious about the patients that we choose who could undergo these kind of procedures, who
Yes.
really need these procedures,
Yes.
and who are actually capable of taking the precautions and the care that these procedures demand throughout
Yes.
the lifetime.
Yes.
So again, coming back, all these things have been possible, or all these horizons we are trying to explore, is all thanks to microsurgery.
Absolutely. From what I understand, if you can summarize summarize what you have said, body when it undergoes a certain traumatic event, or in the case when a person faces amputation, or for some reason they need a reconstructive surgery. And with great skill, dexterity, and great knowledge, microsurgeons um, bring an equivalent part of that to be joined with the body. But even if the function and form are restored, the body sometimes rejects it, considering it as an outside object. So it starts to attack its own limb, which is now connected with it. So to prevent such attacks by the body and make it comfortable, or at least avoid those conflicts between the original body of the patient and the recipient part, um, if we could come up with a way to suppress the immune system's response, then the acceptance of such reconstructed parts would be a lot higher, and the patients would not have to take um, lifelong medicines for such immunosuppression, which can have otherwise other devastating long-term effects.
Yes.
Okay. So, as a surgeon innovator, since this is a cause that you find really impactful, what kind of support systems would you require? What kind of challenges would you face if you were to go in the journey of such innovation?
Naturally, so we are thinking of devising or finding medications which will improve the safety of transplants,
Yes.
right? So naturally, to create such a molecule, it has to undergo a phased trial
Yes.
through different stages.
Yes.
The safety has to be ensured, and there has to be enough evidence to prove the efficacy, because there should not be a compromise of any sort on the efficacy
Yes.
just to improve safety.
Correct. Correct.
Both are equally important,
Absolutely.
and both need to be balanced to the perfect manner.
Yes.
So eventually, the research on this has been on for quite some time now, but there has not been any significant breakthrough,
Right.
at least in
Right.
the last 2 decades.
Yes.
So what eventually we need to detect, or one more thought process was to create a chimerism.
Right.
What that means is, chimerism, you have heard of the chimera. It is and say mythological creature which has the body parts of 2 3 different animals
Yes.
together. So what that means is that all those body parts of different animals, different creatures, are existing symbiotically.
Correct.
So the body does not react or respond to a foreign, a foreign substance,
Yes.
or it does not display its
Hostility towards them.
hostility
Yes.
towards
Yes.
it. So creating chimerism within the human body
Yes.
is something which has been tried upon since a very long time,
Yes.
but not successful enough. But if yes, that is probably the way to go ahead, in which when the donor cells are introduced into the recipient cells,
Yes.
to prime the recipient for what the donor cells are,
Yes.
so that the body gently accepts them as a part of our own,
Right. Right.
without demonstrating a very significant rejection response to it.
Yes.
And then when a transplant is performed, after that initial priming, or after that initial chimerism has been created,
Yes.
then the transplant could survive without the need for any medications.
Yes.
So that is something that needs to that actually needs help of multiple specialties. It needs help of researchers, it needs help of biologists, it needs help of immunologists, in order to be able to do this. But then eventually that is the only way probably I think it can happen.
Yes, yes, absolutely. And I think that points out a um, very real aspect of innovation, that it is always multidisciplinary. And even if it is applied to a specific field, there is typically, for example, in this case, the need of that innovation is coming from surgery, and the application also would be finally over there. But as we backtrack how the innovation is created, then we would definitely need people with multiple specialties, and all of them could collaborate to come up with a solution to this. Then the society at large will benefit from it.
Yes, definitely.
So I think that's a very futuristic way of looking at transplants, and especially the chimerism aspect that you mentioned. To me, it seems like having a equivalent of a vaccine, but which is not for attacking, but it just primes the body that okay, something like this is going to happen. So you might as well get comfortable with it.
Yes.
And once that happens, then the body would be more uh, accepting of the transplant. And
Yes.
this could even lead to greater acceptance of not only cadaveric transplants, but nowadays there's also been a lot of scientific progress and engineering breakthroughs in in artificial organs, so 3D printed organs. So I can only imagine that if we had such an agent available in the future, suppose a hospital has its 3D printer which is 3D printing organs, then any patient who walks through the door of the hospital and needs a transplant can immediately um, get the organ of their requirement made, and at the same time, if they could accept it without having any um, side effects, then I think it would really be wonderful.
Yes, yes. So 3D printing actually is a very, I mean, innovative technique, and the scientists have actually 3D printed ear.
Yes,
The ear pinna has been created in a lab, and they are actually working on creating structures from the hand as well,
yes,
creating a scaffolding of the bone or creating a tendon.
yes,
But of course, getting a functional hand through 3D printing is still a long way, because of the complexity of the structures,
yes,
and because of the multiplicity of the structures, because you have structures like you have skin, you have tendon, you have blood vessels, you have nerves, you have bones, and plus the anatomy is quite intricate and complex
yes,
to be able to do complex activities and to be able to bear the weight.
yes,
So I mean, to be able to build such a strong and robust 3D printed organ would definitely take some time,
yes.
but definitely some the effort is there in that direction as well.
Right, right, absolutely. Um, so for the next section of this conversation, what would be your words for someone who wants to participate in such innovation, or someone who wants to support in such an innovation? Because some people might not be from surgery or science background, but they still want to um, associate with the overall access to surgery cause that we are working on here. Then what would you like to tell them?
First thing is that we have to identify a problem. We have to identify a problem, and where we could make a difference by making a certain change happen, right? That could be, the difference could be in terms of the outcomes of the surgery, or it could be in terms of the duration, or it could be in terms of the cost, in order to make the process more effective.
Yes,
And then naturally the demand at different levels, or different say different towns or different setups
yes,
would be different.
right,
So it could happen at multiple levels, it could happen at multiple individuals, based on what problems they face on a day to day basis.
yes,
So innovation actually could happen at all these levels, and then it could find its applications to the respective parties.
yes,
So I believe that we need to, besides following the set guidelines, we also need to be thinking out of the box.
Absolutely.
We also we also need to think of what could be better, what could be more efficient, rather than following the same routine all over again.
Yes. Yes.
And then naturally you need to team up
Hmm. Hmm.
with the different experts, right? Like you need biomedical expertise, you need engineering expertise in order to make the innovation a reality.
Yes.
And of course you need backup from the industry in order to go through the R&D, or in
Yes.
order to go through the process,
Absolutely.
in order to get a product which is which finds its application throughout the broader section of the society.
Yes. Yes.
So I believe that I mean, innovation could happen suddenly when a thing that you're doing
A
just
eureka
happens.
moment in a
Yeah,
way.
it's a
Yes.
eureka moment, or it could happen through multiple trials and errors, and then finally you land up getting something that you are actually looking for.
Absolutely.
So I mean, it could be a very variable journey for I mean, in every situation it is likely to be different.
Yes. Yes. So great. I think that sums up the innovation aspect of this conversation. And just out of curiosity, um, how did you decide to become a surgeon? What made, what was that moment where, was there a moment where you decided that yes, this is what I want to do?
So I do not recollect any specific particular moment that made me decide, but ever since I entered my MBBS, I always had a surgical inclination. So it
Right.
just happened quite naturally to me
Yes.
that I mean, the anatomy was one of my favorite subjects. Surgery was my favorite subjects,
Yes.
and the combination of both of them probably led me to plastic surgery as well.
Yes.
So it all happened quite. The progression was quite natural,
Yes.
and I don't recollect any specific thought or effort going behind it. It just came very naturally to me.
Yes. Yes. As they say, you didn't choose plastic surgery; the plastic surgery chose you. Great. Great.
Yeah, probably.
And when there are, I'm sure there would be very challenging moments in some of the operations where a lot of high tension situation might be there. Then how do you, as an outsider, I only, if I were to be a surgeon, then I would be very very challenged to make a decision which can change the life of a person right there and then. How do you go across such situations?
So the preparation begins with the planning.
Right.
In most of the situations, you always have you have always have to plan well, and you always have to consider the pros and cons. You can have to consider the variables in every surgery. You have to have your plan B and plan C thought over,
Yes.
and so that takes care of most of the problems.
Yes.
And of course surgery is always a learning process. With each surgery is different. Each surgery you're learning something new.
Yes.
And if you keep a stable cool mind, it helps you tide over any sorts of problems. So you just have to trust have trust in yourself, have trust in him, and go ahead.
Yes.
So that's what keeps you driving, and that's what opens up the new pathways.
Absolutely. I think that's a great takeaway from here, not just for surgeries, but even for many situations in life. So, thank you so much for your time. And this conversation was very insightful for me, and I'm sure it will create a lot of awareness around the area in which you have been working, and it definitely will help in creating more awareness around what we need to do in it next. Thank you so much.
Thank you so much, and best wishes to you.